This is Steve Moreland with The Natural Upgrade. Thank you for being with us and tuning in today. We're going to be focused on nitric oxide, and we want to talk about this because there are many individuals that are through Nature's Pure Blend, the company that sponsors this podcast. And a lot of people want to be better educated about nitric oxide. Maybe they have hypertension, they have high blood pressure, or something regarding their cardiovascular, and they're trying to understand what is this thing called nitric oxide? How does it benefit me? Should I take it? How much should I take? And so what we have today is we have a certified family practice medical professional here today. Dr. Habib has decided to jump on here with us and kind of go through his journey and how he looks at not just medicine in general, but how he has kind of transitioned his perspective, his philosophy about looking at natural or diet related assistance to change your lifestyle so that you can reduce potentially the number of prescriptions or pharmaceuticals that you might need to be tethered to. So, Dr. Habib, thank you for being with us today here, sir.
Thank you for having me as well.
Tell me a little bit about your passion for medicine. What got you into this particular industry to help people?
So as you just mentioned, I practice family medicine. So I literally see everyone and anyone who walks through the doors. My in- intention originally to become a physician was to help patients really to kind of cure illnesses. And it's a big word to use, to cure, because it has become more difficult to actually help cure illness. We try to maintain and decrease the adverse outcomes of having illnesses at the moment.
Okay. So when you're saying decrease the outcome, does that mean you're focusing on decreasing symptomology or actually aiming at solving the causation of what creates illness?
So that was, I'm glad you mentioned that. So that was when I started to think more about addressing the root of the problem rather than treating the symptoms. And if you address the root of the problem, you're able to decrease kind of the bad outcomes.
Of course. So I'd love, this is going to be a kind of a peeling back of the layers of the onions because it sounds like you've gone on your own personal journey. And I know that there's a personal story that you and I were mentioning before we decided to press the record button, that you were able to work with your brother-in-law, if I understand correctly, and get him back to a healthy status.
Yes, that is correct. So it was actually, to tell you a little bit of backstory, it was actually my wife who started this whole kind of road that, we need to eat better and improve, especially with my family history of medical illnesses. And my brother-in-law was diagnosed with diabetes. And when he went to see his doctor, he told him, well, you're really going to be on medications for the rest of your life. Didn't really talk about diet or exercise. And I do sympathize with them. There's very little time with patients nowadays, as you know. But I talked to him and I did something kind of crazy. And I told him, well, how about you stop the medication and start eating better? And this was about almost 3.5 years ago. And since then, if he goes to see any doctor or any new doctor, they're actually surprised that he has diabetes and he has not taken one medication or one tablet to even help with that.
There's so many things that could be, I guess you would say, not just remedied, but also from a preventative basis, just by us as individuals starting to focus on what we are putting in our bodies.
Exactly. Yes. And that starts literally with just everything that's on our plate. That's really how to tie in what I just mentioned, that's how I started talking to my brother-in-law. And if you just simply watch what you're eating and adjust your eating habits, because it's not a diet. If it's a diet, then you will quit it tomorrow or the day after, but then you will have the illness again. That defeats the whole purpose. then you're able to control, and rather than just maintain, you're able to address and cure some of your illnesses.
Okay, so you've decided to reframe the term because you're saying if it's a diet, then it's going to be temporary and you won't maintain it. So what do you call this different protocol, doctor?
I call it, that's how we're going to eat from now on. That's our new eating.
It's a lifestyle.
Yes, it's
Okay.
not a diet. If
It's
it's a diet, it's not worth it.
got it. I love it. So you reframe the entire psychology about how we're going to do this. It's not a temporary fix. This is the new way you live.
Yes. Yep. You have to
Okay.
change completely and make it permanent.
So when this turnaround in your brother-in-law's health happened so radically, where he was able to reduce, I guess, this type 2 adult
Right.
onset diabetes, and he was able to so radically reverse this that has not had to take insulin for it.
Yes.
What is the response from other medical professionals?
So he didn't get to test that because he kind of established with a new doctor. But I can tell you that, I did end up going with him to one of his visits, and his new doctor was actually surprised when he told him he has diabetes because he ran all the tests, the conventional tests such as like fasting sugar or hemoglobin A1C, which tests your average of sugar over 3 months. And he told him, I'm not sure when you had diabetes, but I don't see it.
Wow, that's amazing. And what you are giving, doctor, is so much hope for individuals that there is an ability for them to, in this case, I hate to use the term, but bring back or reverse a position of illness and actually get back to homeostasis.
I completely agree. It's very doable. That's number one. Number two, it is reversible. Your body can take a lot of hits before it gives up. You just have to give it some time to let it heal.
Okay. Well, if we're going to talk about diabetes, which I know is epidemic, and the number one epidemic happens to be cardiovascular, it starts off with hypertension, I think, or the high blood pressure term that most people are more familiar with. Tell me what is that, because hypertension, high blood pressure, cardiovascular disease is still the number one problem in America for sure, where I think cancer is probably number two, maybe diabetes is three or four. Am I pretty close?
Yes, you're right. And to put it globally, there's actually a lot of public data that you can pull, and hypertension is right at the top of the list, followed by cardiac disease, and diabetes falls into number three.
Wow.
Globally. US, it changes a little bit of the ranking, and diabetes falls a little bit higher to number two as well, followed by cancer being number three.
Okay.
Like from about 1 year ago data. So I haven't kept my up to date yet.
Oh, no, sure. But that means that diabetes is racing at a breakneck speed to surpass cancer that has always been in that number two slot.
It has, yes, and it's rampant, unfortunately, and it ties hand in hand with hypertension, and it's kind of falls into this cumulative category of illness that is defined, or not defined, I should say, that is mentioned as metabolic syndrome. Might have heard the term thrown
Yes.
around a lot, and it ties into a point you mentioned earlier that literally kind of how I view metabolic syndrome or metabolic disorder as a deviation from homeostasis or the normal body balance.
Got it. So you're seeing these when you're saying a metabolic syndrome. That sounds to me like these are functioning. I think multifactorial is the term I keep hearing, where
Yes.
they're interrelated.
Yes, sir. Involves a lot of parts of the body. In bigger terms, it involves a lot of organ systems, and it tends to have an adverse effect on right about every single organ, from the brain, eyes, heart, lungs, kidneys, even the GI system, and of course the GU system or the urinary system as well.
Nobel Prize won in 98 for the discovery of this, I believe, a molecule. Kind of break down what nitric oxide is so the viewers and the listeners kind of have a baseline, doctor?
So nitric oxide, its physiology in the body is that it works. So just to kind of set a little bit of a stage. So if you think of our vessels as like pipes, and the pipes have like a surrounding outside coating, we think of it as muscles. They're literally little muscles. And nitric oxide helps to kind of relax those muscles. They're called the smooth muscles. And that's just because of how they look under the microscope. And it is naturally occurring in the body. It also works a little bit as an antioxidant. So sometimes when we're under a ton of stress, you can run low on that. You can see your blood pressure spiking as well. And then the body tries to return itself to that stage. And that's how nitric oxide tends to work in the circulatory system. In the lung, it actually has been used quite a bit to help with lung hypertension or pulmonary hypertension or high blood pressure in the lungs. And that's even used in some cases in the ICU as well for patients who have a lot of respiratory distress due to pulmonary hypertension.
That's a lot. So let's kind of see if we can't peel the layers back of the onion here. I followed what you just said. So let me kind of go back and ask some specific questions. So we know nitric oxide, or this metabolic syndrome, sounds like it's attacking all of us. And the source of that is either a combination of the sedentary lifestyle, that we don't exercise, we don't move enough. Number two, our diets are horrible because we're eating ultra processed packaged foods instead of real food. And then I hear you talking about another thing there called stress. You're saying stress from a pulmonary standpoint. Is that also just stress from occupational stress, relationship stress, financial stress, social media stress? Is all those combined and affect our blood pressure?
Yes, of course. And the most important one is food or processed food. One, because of the content of it. I mean, some of these things contain a lot of salt, and that's bad for blood pressure. Just to put it simply, there's a lot of background to that. And yes, stress does play a major role in our life, from causing the high blood pressure to also literally causing damage to the heart. There is like full proven syndromes that actually are caused from stress. And if you like an example, if we have time, I can even tell you one.
Okay. So when we're talking about the stress and you're constricting, you use the word smooth muscle. So that's am I using endothelium? Is that the correct term for that vessel muscle?
Yes, sir. So it's
Okay.
just right under that.
Okay. So when we have nitric oxide that occurs in our body, then that relaxes these smooth muscles, reduces the constriction and therefore the scarring that happens from overconstriction. And the relaxation of this increases blood flow, makes our circulatory system run easier, I guess you'd say.
Yes, exactly. It makes the blood flow better. That's number one. And if you think of the heart as the center of literally the pump or the engine to our circulatory system, it decreases and I would use a word you used before, the stress on the heart. So if you relax the vessels, you're decreasing the blood pressure. In return, you're decreasing the preload or the workout of the heart, and you're causing less damage to the heart, less damage to the vessels, and that will help kind of overall the kind of maintaining the homeostasis of the body.
Okay. So now that we understand how all of this or the importance of all this, let's get down into, because you are focused on diet, that means that there is a way that if we focus on diet, and then of course, secondarily on exercise or movement, thirdly, reducing the stress, but let's focus on diet. How do we get nitric oxide out of our diet?
Uh, so, so nitric oxide out of our diet can be found in, I believe, green and leafy vegetables. So if I recall my research, which I did a little bit ago, it's found in spinach, if I recall that. But it's also made in the body naturally by consuming certain types of amino acids, and those are the building blocks for our protein. Supplements as well help to increase the levels of nitric oxide in the body. And if I recall, beets may contain nitric oxide, so those also will help to increase the level of that.
Okay. So there's a process there. We take in these certain vegetables that have the nitrates. Then during our metabolism of the nitrates, that's when they are converted. Do they go into the amino acid L-arginine and L-citrulline at that point? Or are those something else that's like a bump that converts it finally into the nitric oxide gas?
So L-citrulline tends to be the precursor for the whole process, and L-arginine is derived from that. And L-arginine is what helps to kind of produce the nitric oxide at the end. It's considered to be in some cases as like a byproduct, but actually the body was able to find it that it was very helpful.
Sure.
And that's what was the discovery about. And L-arginine itself is one of kind of the important amino acids. And it tends to be, this whole process tends to happen in the liver. So it's important to also have a good, healthy liver to allow for that process to occur.
Got it. Got it. Is there a benefit of either one of these amino acids functioning separately, or is there a synergistic effect when they work together?
So I'm going to answer this a little bit broadly. There is a synergistic effect. So that's the short answer. There is nothing in the body you can isolate and say, I'm just going to take this and hopefully it works. The body tends to work in harmony. It's like a symphony. So simple example, I can say I'm just going to take vitamin B12 and that should be fine. No, your body still needs the rest of the vitamins. So can't just say I'm going to work on raising one item and letting the other one fall apart. So to focus more back on your question, they work together in harmony to help improve the production of nitric oxide, to help increase the level of nitric oxide in the body. And therefore helps to kind of have the benefits that we previously mentioned about the blood pressure and the stress on the heart.
Okay. Is there anything that as we are aging and these vessels, because any engine that runs for a period of time starts getting tired or starts not running as efficiently or as effectively, is there a problem with nitric oxide as we age as far as a deficiency?
Yes. So as you just mentioned, as any engine kind of gets a little bit outdated, it tends to run ineffectively or inefficient. It's not doing its job as it should be. So yes, decreased nitric oxide over time as we age. And again, that goes back to the previous part of having a healthy liver. And it's not, you have to do anything. Things will slow down as we grow older and wiser. So the nitric oxide production does decrease over time. So it's important to have a good, healthy liver to allow for this process that we just mentioned to occur and allow for the production of nitrous oxide. But no, you don't have to do anything to kind of cause that production to slow down. It's just as we age, as we get older and wiser, this process will tend to slow down on its own. And hence you start seeing a little bit more of the adverse outcomes. So such as like worsening hypertension control, leading to more stress on the heart or more heart attacks or more strokes. And that's kind of the aging process that you were referring to.
Sure. So if we're going to be combating this whole thing called metabolic syndrome, combination of everything, nitric oxide sounds like something that we can't get enough of it out of even good vegetables, even if we're eating spinach and beets and arugula and all those other types of vegetables. It sounds like there's an increasing need as we age to supplement and making sure that we're getting these amino acids like arginine and citrulline to make sure that we have good cardiovascular health. And that then affects our other processes in our body that you were referring to in the metabolic syndrome.
Yes, that is correct. And having the nitric oxide supplement which contains the basic amino acids that we just mentioned and talked about. Basically, literally the building blocks will be provided to the body to allow it to process it and have outcome of nitrous oxide in that process. It's definitely important as it will help to lower blood pressure.
So, as you're saying, the combination of everything together works, but having that nitric oxide as a building block with those amino acids, something that we need to keep supplementing as we get older because it affects everything in our body. Everything is related to the ability for our cardiovascular system to feed it.
Yes,
Okay,
exactly.
I understand.
You're basically providing the building blocks, to allow the body to make nitric oxide to have a better outcome of controlling hypertension, lowering blood pressure, and decreasing cardiac adverse effects as a result.
Well, Doc, you've given me so much hope and faith. I know people that are listening and watching this are going to feel that there is hope, and it's not necessarily being tethered to a pharmaceutical shelf. There is the opportunity to have a better diet. Like you said, it costs a little more, but it's your life, so
Yes,
paying attention to that and then having those right types of nitric oxide that help the entire value of the diet that you're feeding yourself.
exactly. Yes. And, to put it simply, I know it's going to sound too cliche, but you're investing in yourself. The long-term outcome of having to deal with 10, 20, or 30 medications, you can kind of start slowing that down. You can start taking control of that. That you can kind of start cutting back on some of the things that might look good or might taste better. And, you're never in prison. So it's always good to enjoy, but enjoy responsibly. And perhaps the thought that, what you're eating can help your body or it can hurt it.
I love that. Very good perspective. Thank you, Dr. Habib, for giving us your time and your expertise and hope. I think that's the bottom line that you gave us through your discussion here. Thank you so much.
Thank you for allowing me to speak and beyond, and I appreciate your time. Thank you.
Absolutely. Thank you, sir.